Hi, I'm Dr. Riley Cubella, board certified nephrologist, and today we're going to talk about what goes into a new diagnosis of kidney disease. Your doctor may call and say your labs look abnormal. We'll have to figure out what's going on. So step one, the first step is, what is your baseline? What was your kidney function before? What was your creatinine, which is the blood test that is checked on routine labs all the time? You may have not had your labs drawn ever before, and this is the first time anybody has ever told you that you have a problem with your kidneys. Your kidney function looks abnormal. So the second step is to repeat the lab, because oftentimes there's something that went on that day that you did the blood work. Maybe you didn't eat breakfast, or you were exercising, you didn't drink water. Maybe you just got off shift from work. Maybe you didn't sleep well, or you didn't, you were sick and had the flu. Whatever it was, you recently were not your normal self on the day that you did the blood work, or there's a lab error. So that's number two, is always repeat the labs. And then number three is looking at potential causes. Are you healthy and you don't have any other medical problems? Or do you already have some medical problems? So whenever there is a problem with the kidneys, we always separate it into primary or secondary. Primary are things that are inherited or they just happen for no reason. And secondary are causes that are acquired because of X, Y, or Z. And that could be because you already have diabetes, or because you have hypertension, or because you have an autoimmune disease like lupus or scleroderma. So determining what the cause is important. Number four, sometimes other tests, including a urine test, is needed. A urine test can look for blood, can look for protein, can look for abnormal cells in the urine. And then another test is an ultrasound, which is imaging of your kidney to determine if you have two kidneys, first of all, to determine if you have equal sized kidneys, normal sized kidneys. Are they swollen or are they shrunken? Have they atrophied? Is one bigger than the other? Do you have adequate blood flow to both kidneys? Is there a blockage in one of the arteries to supply blood flow to the kidney? So lots of reasons for abnormalities, those that an imaging test can easily rule out. Sometimes a CT scan is done if there's an abnormality with ultrasound, but ultrasound is the first test and the best test because it's really non-invasive. And the last piece of information a nephrologist can order is a kidney biopsy, which is a usually ultrasound guided, sometimes CT guided, where a needle is injected in the back in the kidney, and a piece of tissue, cortical kidney tissue, is evaluated under the microscope by a pathologist who is looking for, again, abnormal cells, looking for inflammation, inflammatory cells, looking for cancer, malignant cells, looking for scarring, scar tissue, just looking for clues as to what could be going on, why you have kidney disease, what the cause is. And then your nephrologist, your kidney doctor, will take all of the information, the risk factors, your family history, your current medical problems, your blood tests, your urine test, and the kidney biopsy and ultrasound results all together to come up with a potential diagnosis and a potential treatment plan, and then explain that to you. I know we did that very quickly and I talked about a lot of things, so please follow me and we'll keep going into each in more detail and get more clarity. Thanks. Bye.